And good day to you, Willard Shepard with Willard Shepard Law and Media on In the Know here on the Miami Community News Network. And we're really honored today to welcome two people and an organization that does so much great work behind the scenes in our community. You know, people always easily take care, or they should take care of their physical health, but our mental health is as important and many times more important. And for so many people in our population, that gets pushed aside. And we certainly don't want that to be the case after the next 30 minutes here on In the Know. Dr. Joseph Poitier, my friend, always serving this community at New Horizons for many years, and Michele Sweeting, the Chief Executive Officer with Dr. Poitier. First of all, welcome to both of you on In the Know. And as I mentioned, Dr. Poitier, this is something in an area that you all work in. I always say people can see when they have an orthopedic injury, when they cough, or they can easily detect, hey, there's something wrong with me. I need to go see the doctor. But all of us could go and learn more about ourselves and be in a better spot if we would come and see you. What is your message to our public about making sure that we're healthy in a mental aspect as well?
Your mental health is very important. It's as important or even more important than your physical health. I equate it to a car. The car's engine is equal to your heart. If your engine doesn't work or your heart doesn't work, you die. If your mental state is bad or your transmission is bad, you can't back up, you can't move forward, you stay in one place. So our mental health, our brain functioning is very important as our physical health.
Talk to me about the specialty, and you all are serving a community that many times is left out when it comes to their mental health, and what you're trying to do, attempting to do, and the message that you want to deliver about people coming forward.
Thank you. Well, Willard, I can tell you that for many years, New Horizons actually started out as like cultural brokers. So we were in neighborhoods with teams that looked like the individuals that we were trying to engage in the different neighborhoods. So we had a Cuban team, a Haitian team, a Puerto Rican team, a Bahamian team, all to educate and engage with different communities so that they could access mental health services, that it would not be a taboo, that it would be something that is helpful and not hurtful, and that we would welcome them at any state that they were in. So I can fast forward to where we are now, just being able to be culturally competent with the communities that we serve. Most of our staff mirror that exact exchange of individuals that we serve, and we want to make sure that people know that they are welcome, that they're not invisible, that we see them, and that we are here to care and to help them.
Before we go any further, tell people how to find you.
Thank you. We're actually located at 1469 Northwest 36th Street, and that's in Miami, 33142. So we're located in the central part of the county, and we're easily accessible off of 36th Street between 14th and 15th Avenue.
And they can certainly find you online.
Absolutely. Our website is www.newhorizonscmhc.org.
Okay. Dr. Poitier, in our neighborhoods, and really where in the heart of your neighborhood where you're located, many times there are circumstances and situations where people could use your care and use your health, but they don't think about that portion of it, or a family member of theirs only calls when there's a crisis. How do we get ahead of this?
We have to educate the community. As we spoke earlier, your mental health is as important as your physical health, or even more important. There's serious brain disorders which can affect us, such as schizophrenia and depression and bipolar disorder. And now with studies and research, we realize that these disorders have their onset in the brain. And your brain function is actually affected. It's not hocus pocus, it's not voodoo. It's your brain functioning that's impaired in most of the major mental disorders.
Mm-hmm. And tell me about the kind of progress you can make if a person comes and they come in advance before there's a crisis to head that off.
It's interesting that you bring it up. We've had several people in a crisis state, be it due to substance abuse, be it due to severe mental disorders, that we've actually been able to help them avoid being hospitalized. There are individuals that we've seen at New Horizons and take care of that are professionals. They serve our fire department. They serve our schools. It's amazing the interventions that can be done if you come at the right time and your family encourages you to get the treatment.
Michele, obviously close to my heart, being an Air Force veteran, and that is that in our veteran community, the rate of suicide is higher. The rate of PTSD obviously is higher. Dr. Poitier mentioned our first responders.
Yeah.
Talk about the outreach for that. We've done, Ron Book and his team in the city of Miami and in Miami-Dade County, a big outreach to our veterans to prevent them from being homeless, because many times our veterans that are on the street in those conditions could certainly use your help. What about that population and how we can help and aid them?
So in terms of the veteran population, we do have, I would say, several options in terms of being insured, but we also have individuals that we can serve that are uninsured. And I think that's, the biggest part that I would want people to take away from this is sometimes people neglect themselves or help because they believe that they don't have the insurance, they don't have the dollars to actually seek the care that they need. For us at New Horizons, we actually have certain individuals that we can serve with the same services, and it's regardless of whether or not they have the ability to pay. And I think that just getting that outreach and that word out there to individuals, veterans included, that they know that they can come there and they will not be turned away for services.
You're the business expert here. After, unfortunately and tragically, what happened with George Floyd, there were so many communications and talks in our community and across the country about how government funding should be used with police, if mental health counseling could be injected in that. And hopefully you're going to tell me there's been some progress in that area about, and I'm very close to many law enforcement officers who I either served with in the military or through my years at NBC have developed relationships with. And they many times say, hey, look, there's a gigantic portion of the calls that we go on that are not dealing with law enforcement, but they actually need Dr. Poitier and your team, not a police officer.
Correct. So it's interesting that you bring that up because we have actually partnered with Miami-Dade County Police Department and their crisis response unit, which is an alternative unit of trained law enforcement professionals that have backgrounds and experience in mental health or psychology that respond to crisis calls or individuals that may be experiencing a crisis. And in that individual unit, it's made up not only of these officers, but also a medical professional, a mental health professional, that is a part of that team that can help to de-escalate an individual. And they have the opportunity to spend as much time as they need to spend with an individual who may be experiencing a crisis, as opposed to having to go to the next call or, having to hand off the individual to someone else. And many times they developed relationships with individuals if there are multiple calls in the community. And these officers have resources and places where they're able to take individuals, and our place is one of those places. So when you talk about money being infused into the system, I can tell you that it is being done on some level. and it's not county-wide right now. I think they're only in 3 different parts of the county, but it would be wonderful if we could integrate more municipalities and officers into that particular structure where it's mental health and law enforcement working together.
Dr. Poitier, what are your thoughts about where we are with that? If you think progress has been made, or even if we have made progress, we got a long way to go.
Yeah, progress has been made. And it's one of the reasons why we're honoring the head representatives of first responders. Our first responders don't get the attention that they need. They don't get the thanks that they deserve. Oftentimes, when people who suffer from mental illness deteriorate, they're first to respond on the scene. When a 911 call is made, they're usually first to respond on the scene, and they don't get enough thanks or accolades for what they do.
Mm-hmm. Well, I think that's fantastic that we're moving in that direction.
Yes.
What would you like to see next going forward in terms of expanding that?
So it would be nice, again, to see that unit expand to all areas of the county and different municipalities, not just with the county, but other municipalities, regardless of the size. I think that mental health in terms of education and places to go for individuals who may not be experiencing, say, a severe crisis that involves them either having homicidal or suicidal ideations, where they can talk with someone maybe who has a lived experience similar to theirs, where they're able to actually share and maybe come up with other alternatives as opposed to going into a hospital setting.
Mm-hmm. Dr. Poitier, elaborate more on the honor for our 2 public servants and the other people you will be honoring on the 4th, and how people can become involved in the program.
We're actually having our 50th anniversary gala October the 4th at the
Jungle Island?
Jungle Island facility.
Right there on the MacArthur Causeway,
Yes.
headed over to Miami Beach.
Yes. And like I said, we decided to honor people who don't get enough accolades, and those are our first responders and their representatives, Deputy Stephanie Daniels and Fire Chief Ray Adala. The information regarding the Jubilee Celebration is on the website. They can call directly at New Horizons 305-635-0666. It's on Eventbrite as well. And there's another number,
the 305-506-5219.
Correct.
Here we go.
Call as well. It's a great opportunity to thank the people that have made New Horizons what it is, and congratulate community members that have helped New Horizons sustain itself for 50 years.
Michele?
In addition to that, we're also going to be honoring our founder, which is Dr. Evelina Bestman. She will also be one of our honorees, and she actually started the center 50 years ago.
Wow.
Was the very first CEO, and was very instrumental even in legislature for community mental health centers, and we were the first community mental health center designated in South Florida because of her advocacy. So she's one of our honorees as well as our current board chair.
And tell me about people getting involved. That we certainly hope with our outreach here that people that weren't aware of the great work that New Horizons is doing in our community, that they would like to get involved. If they have a business, they have a company, they're located not just in one of these areas, but anywhere in Miami-Dade County or across South Florida.
So for individuals who are interested in being involved with New Horizons, there are different community collaborations that we are a part of. But if you are interested in volunteering your time, there's a process that individuals can go through, in order to become a volunteer with New Horizons. So whether or not that means you're greeting, individuals that come through our doors, if you actually are participating in some type of helpful capacity with the staff that are working there, there's always something to do. There's always a need for volunteers. And as you know, it keeps shrinking. Our workforce keeps shrinking. And just community-wide and collaboratively, you can actually come to seek ways of how we can actually partner. We partner with various other community mental health centers that are in the area. We collaborate with, of course, our law enforcement partners. We also partner with the Miami-Dade County Public Schools. So, the Addiction Services Board, which is one of the county boards. So there's multiple ways that we can partner together.
Well, I'm going to reach out to my friends at Miami-Dade County Police and at Miami-Dade Fire Rescue to make sure that we get them over here so we can talk more about this program and the collaboration of when there is an incident that you all are able to intervene and hopefully reduce it. And to that point, Dr. Poitier, what about our youth? Unfortunately, here in South Florida and recently over outside of Atlanta, we've seen young people, teens, taking extremely violent actions where people have lost their lives about this. What do we need to be on the watch and lookout for when it comes to young people? I used to sit behind in court the person who took the individual's lives at Parkland when he was in court each day before, him now being incarcerated with the Florida Department of Corrections, and thought about that when I would see him come in and out of the courtroom about how a person of his age got to a point of where they would take that type of action. And this individual recently in Georgia was just 14. So what can we do? How can we notify or identify where something may be going off the rails?
We serve children as young as 6 years old, and in the modern age, where children now have cell phones, they have access to computers, they've lost humanism.
Mm-hmm.
They've lost the human touch, talking to people rather than talking to radio or talking to a computer. And that's where we have to get back to humility and the human aspect of relating to one another. I think we've lost that. The other thing is access to weapons. The amount of weapons now and the people that carry weapons, I was surprised a lot of women that I see actually own firearms, and we must keep our firearms locked away. And even when individuals experience depression, I tell them to make sure they give their firearms to somebody else during this period. But we must treat our children in a more humane manner, and this access to weapons must be decreased.
What does it do to our young population that they're at school now and a portion of the first day of school is an emergency drill, an active shooter drill? What does that do to our young population just being exposed to that?
It is traumatizing, to say the least. And it's one of the reasons why we've seen more mental health problems in our children. Imagine being a child. You have to worry about staying alive in the classroom while the teacher's trying to teach you. So it's had a significant impact on our children and continues to do so. That's why we must do something about weapons and make sure we intervene when kids are exposed to traumatic experiences.
We are the only westernized society that has this issue of having more guns than people in our great land. You mentioned about our public schools and your relationships with them.
Yes.
Address that portion of it and the types of intervention, not just in a crisis, but as Dr. Poitier just mentioned, the simple fact that you're going through this drill tells a child, hey, this isn't good. Something might happen here.
Correct. And I'd just like to add just the level of anxiety, too, that, our youth are faced with when they're going through these, simulations. That's not good for them either in terms of the learning environment. In terms of schools, when we're in schools, we do have programming specifically for the youth, but we always involve the entire family, which is extremely important because a lot of the issues or concerns that we see sometimes stem from the family unit. So one of the programs that we actually have that's in Brownsville Middle School is a program for youth who have been either truant, a lot of absences, disruptive behavior, school failure. So with that program, we actually partner them with mentors, and they actually engage these students every single school day for at least 10 minutes to engage, to build rapport, to find out what's going on. Are they keeping up with their subjects? Is there any, concerns with, individuals or persons in the neighborhood or in the school? And we have seen great success with that program because every 2 weeks, we're also checking in with family members, whoever they identify their family to be. And through that partnership between the school, the youth, and the families, we've seen great gains in terms of better grades, less disruptive behavior, and of course, their tardies and absences have decreased.
Dr. Poitier was talking about how young people are impacted by social media. Everyone's on their phone. I think it's impacted those of us adults as well. When I go places, I'm generally a person that likes to have a conversation with somebody, even if I don't know you. And therefore now when you go in a place, whether you get on public transportation, you get in an elevator, instead of saying, hey, hi, Michele, I like your jacket there, which I do. And Dr. Poitier, that's a fancy jacket you've got on there, and have a conversation. People are buried in their phones. What is that doing to us?
It's dehumanizing us. It's sort of unfortunate, but we've lost touch with human feelings. You can't feel the emotion that you experience talking to someone when you're talking into a phone or using a computer. And as a result of that, society's humility, our ability to experience the sadness or trauma that somebody else is experiencing is lost. We just, our sense of feeling what other people feel is lost in our current wave of technology.
There's a program where people who train canines attempt to place them with veterans, and it's associated with our NBC program, Days of Our Lives and things. And they had an event here in Florida over the weekend, and the woman who is the canine expert said that their research has shown that 54% of people bond more with an animal than they do with other people now. And that was alarming to me.
Wow.
But to that point, what kind of role can a pet play in helping a person with their mental health and feeling good about themselves and just interacting other people? I can just think of, my animal population in my home is growing because my wife volunteers at the shelter and she's bringing them home all the time. And so even in the neighborhood, conversations and those types of things. So what role can a pet play in this?
It's amazing the amount of pet support letters that I'm writing now. they play a tremendous role, and people are asking for these letters a lot more than they have been several years ago. And I think animals give you unconditional love, which is what really need as people for one another. But unfortunately, we have to turn to our pets to get that unconditional love.
Well, to that point, then, I will encourage everyone in Miami-Dade and in Broward. They have so many animals to adopt that they can't accept any more animals. My son found a dog, out on the street that took it to the shelter, but they were like, we can't take any more animals. And so now my son has a new dog. And so therefore, I would encourage people, because of what you're saying, and in general, to go to our shelters and in Miami-Dade and Broward and aid. You're aiding them. You're aiding a family that may not be able to take care of a pet for economic reasons or a new job or other types of things. So it's great to hear you say that the pet can actually provide that kind of support. As we move forward and as we wrap up, as a community, what can we do to help you, which in turn will help all of us?
I think that how the community can help New Horizons is that we can show support for our family members, our friends, our neighbors. We all know someone who may be going through a tough time. We all know someone who may be feeling overwhelmed. If you could just show empathy and resources to that individual, I think that we would all be better off as a community if there's something that you can do to aid in that process. And it doesn't take a lot. It may just be a conversation, just alerting them, hey, did you know that this center exists? And they can talk to you about what's going on. And I think that when we show that level of compassion and, as the doctor was saying, humility, then we can engage them to actually get the services that they need.
And if a person has a crisis or someone they know is having a crisis, what should they do immediately?
Well, if they're experiencing a crisis, they should call the 988, which is the National Suicide Line. They can speak to an individual that most of the time is local. Sometimes they are out of the county, but for the most part, they are local individuals that will talk with them to determine whether or not it's the level of lethality, whether or not they need to speak with someone now or they need to dispatch someone because it's a more grave sense. And in that conversation, we see individuals that are on the lower end of the spectrum, where if they're just feeling overwhelmed or escalated, they can come to one of our programs called the Living Room, and they can have a serene setting, speak to individuals that have mental health or substance use issues as peers who are there to help them along through the process and come up with a plan so that at the end of the day, when they've calmed down and they've de-escalated, they walk away with a plan so that if they feel that way in the future, they know what to do the next time.
Dr. Poitier, again, you will be at Parrot Jungle on the 4th of October to honor these first responders and people in our community doing this help with you. What can we all do to help you, which will help our community and protect all of us?
Financial contributions would help our agency. We tend to rely on state and county dollars. Unfortunately, we're not funded as well as other entities are, and the state of Florida is one of the lowest states that spends money on mental health per capita. So I think we need to turn to our legislators and legislative body to pay more attention to mental health.
Okay, well, Dr. Poitier, Ms. Sweeting, thank you so much for all that you're doing. I say toiling behind the scenes to protect all of us and to aid our community in moving forward in a healthy manner. and good luck on the 4th. We appreciate you coming on In the Know, and we'll see you soon here on the Miami Community News Network.